Hi, I'm Lou Hayden. I'm a family nurse practitioner, and I'm speaking to you from the CARPS meeting in San Diego, California. Today I presented on asthma, and as you know, in primary care, it is one of the most common diseases that you manage. And I have three takeaway points that I want to remind the audience. The first is that this is a disease which we're learning more about the phenotypes, endotypes of the disease because people present with different constellations of symptoms, and because of the underlying pathophysiology, they respond differently to different medications. Hence, we don't have a one medication treats all or one Band-Aid treats all types of asthma. So it's important to understand the phenotype and therefore the informed treatment options. Or if you already are treating your patient and the patient's not doing well, need to step back and think, well, was this a different phenotype and do we need to do more investigating? The second important point is that asthma is a dynamic disease, and the control that the patient has today is not necessarily the control they're going to have next week or next month. For example, patients may do very well all summer unless they're very sensitive to the outdoor pollens and mold counts. But when they hit September, October, the rhinovirus season begins, and viruses are a very common trigger of exacerbations and worsening control of asthma. And the third point is that if you have a patient, despite your best effort and using appropriate guideline-informed medical treatments, if they're not doing well, they may indeed have severe and difficult to treat asthma. And some of the things you need to consider if you're moving to that diagnosis and therefore needing to refer on to an asthma specialist is, first you want to evaluate what is the patient's adherence with their treatment plan. Were they able to purchase the medication? Are they using it as it was prescribed, or have they cut it back to once a day because it will last them twice as long? The second is because asthma requires a use of multiple inhalers, each requiring a different technique. Are they using correct technique if indeed they are using their medication? The third point is, what are the triggers for their specific asthma? Are there environmental triggers such as allergens or irritants? And if they had exposures, or if they're allergic, have they added a new pet to the household, which is now putting their asthma in a greater lack of control? When you have a patient with severe asthma, another important consideration is, what are their comorbid diseases? Are their symptoms secondary to something other than the asthma inflammatory process? Do they have gastroesophageal reflux or laryngopharyngeal reflux that is causing them to cough and feel like their airways are irritated? And finally, do you have the right diagnosis? Because there are a number of diseases that can mimic asthma, such as COPD or vocal cord dysfunction, or a number of pulmonary diseases such as interstitial lung disease that you need to rule out as you're trying to treat a patient who seems to have out of control asthma.